All right, let's get started. Welcome everyone to our webinar, Addressing Vaccine Hesitancy Through Education and Outreach. My name is Stacy and I will get us started today. Just a few reminders before we get started. This webinar is being recorded and will be posted to our Asian Health Equity YouTube channel. The link will be emailed to you, so you can feel free to go back and listen to the webinar and share it with your colleagues. There's a Q&A section at the bottom of your screen where you're free to type your questions. If time allows at the end of the webinar, we will answer them. If we don't have time to get to your questions, we will send a follow-up email after the webinar. If you have any questions after this webinar, feel free to email us at marygrace@asianhealth.org. And just another thank you so much for joining today's webinar. My name is Stacy Coe, and I'm the Community Outreach Specialist for Chronic and Infectious Diseases at the Center for Asian Health Equity. The Center for Asian Health Equity, or CAHE, is a partnership between the University of Chicago Medicine and the Asian Health Coalition, which is a nonprofit organization focusing on improving the health and wellness of Asian, Pacific Islander, African, and other immigrant communities. We work with advocacy, technical assistance, education, and outreach. We also work with community-based organizations, community health centers, and local health departments, taking a collaborative partnership approach to support the development and implementation of culturally and linguistically appropriate health programs and initiatives. I'm now going to introduce you to Mary Grace, who is a program manager for chronic and infectious diseases. She will go over more details on Asian Health Coalition's vaccine programs and the process of understanding the community needs and creating culturally tailored education to address vaccine hesitancy.
Awesome, thanks Stacy. So to get us started, let's talk about what the need is within the community. There is a lack of data surrounding historic vaccination rates within the Asian, African, Black, and Middle Eastern communities, showing a need for more disaggregated data, specifically within refugee, immigrant, and migrant, or RIM, communities. Disparities in social determinants like income, education, barriers to health services, perception, and prevalence of health conditions are easily hidden due to the aggregation of multiple ethnicities into a single racial group, or even collectively as other. For example, the census commonly depicts Asian Americans as a group having a high average income, yet there is wide variety in income levels between Asian subpopulations. According to the Pew Research study, Southeast Asians, Nepalese, Laotian, Bangladeshi, and Cambodian are more economically disadvantaged. Similarly, health conditions are often hidden when the data is not disaggregated. Now let's talk about vaccination rates among the RIM communities. According to the CDC's Surveillance of Vaccination Coverage Among Adult Populations US 2018 report, vaccination coverage among US-born adults was significantly higher than that of foreign-born adults. Disparities in vaccination are often associated with lack of access and low vaccine acceptance. While the COVID-19 vaccination has been relatively high among the broader Asian American population, certain Asian immigrant groups have low vaccination rates related to lack of knowledge, limited access, language barriers, religious and cultural beliefs, and vaccine hesitancy. In addition to those factors that impact vaccination in the Asian populations, the Black and African immigrant populations have higher rates of medical mistrust due to historic and current experiences with racism and discrimination, eliciting vaccine hesitancy. Similar to the national data just discussed, the Chicago Health Atlas states that 33.6% of Asian and Pacific Islander adults and 25.9% of Black adults were vaccinated for the flu, compared to 43.2% of white adults. This shows that the local and national data are aligned and that vaccination rates, here specifically for the flu, are lower among communities of color. This table, containing the data from the National Health Interview Survey, shows a similar pattern of low vaccination, but among refugee, immigrant, and migrant communities. Foreign-born individuals have significantly lower vaccination rates when compared to US-born individuals. Within each vaccine, foreign-born percentages were lower. This highlights the need for vaccine uptake in communities of color, even more so in RIM communities of color. What does the research say we can do to increase vaccination rates among these communities? One manuscript titled Critical Considerations for COVID-19 Vaccination of Refugees, Immigrants, and Migrants stated the importance of identifying and overcoming barriers to vaccination within these RIM communities. To overcome these barriers, these practical solutions were given. First, individuals should receive information in their primary language and in a culturally appropriate manner, also taking in consideration education level. Second, they should get more information from a trusted source or trusted individual, often including community-based organizations and influential messengers. Third, information must be vetted by the community, meaning the community is included in the planning process and is able to get feedback. And lastly, information must use effective communication methods. Now that we've discussed the data and the research, let's talk about Asian Health Coalition's 2 different vaccine-related programs. These programs focus on creating culturally and linguistically appropriate outreach, education, and vaccination among Asian and Black refugee, immigrant, and migrant communities in the Chicagoland area. Regarding education, since June of 2021, 403 individuals were educated on general vaccine knowledge and COVID-19 and influenza-specific information. In terms of actual vaccination, over 8,000 of the COVID-19 vaccines were administered, and over 80 flu shots were given in our population. Today we will be talking about how to address vaccine hesitancy within Asian and Black RIM communities through targeted education and outreach. Using the research as our guideline, we created and utilized this 4-step method to develop our outreach and educational materials: listen, create, adapt, and monitor. First, listen. There is no way to understand the community if you do not listen to them first. It's important when creating targeted materials to hear the community's own perspective, to find out their unique needs, to understand the largest misconceptions and drivers of vaccine hesitancy, and then to use that information to create what is best. The intervention you create should be catered to the specific vaccine-related hesitancies and misconceptions and individualized to fit the community's needs. This does take a lot of planning and work, but it can be done in a multitude of ways. How? One key to our success was the use of influential or trusted messengers. These are community members that are well known and respected. They usually represent the community, speak the language, and understand the culture. These trusted messengers are able to reach otherwise hard to reach people because they are established and have relationships with other community members. Therefore, they are able to obtain candid perspectives that someone from the outside would not be able to get. These influential messengers are integral pieces to the program, and they are involved in all of the steps. They help obtain information, review materials for appropriateness, provide feedback, and disseminate those materials. The way Asian Health Coalition listens to the community is through focus groups, listening sessions, and surveys. There are many other ways to listen, but these are the methods we focus on. In addition to helping community members open up, influential messengers enable the sessions to be held in their preferred language. The second key to success is the training of these influential messengers once they are identified. They undergo training on how to hold listening sessions and focus groups, and how to disseminate the surveys. They are provided with scripts and any other materials required, and are shown how to use these materials effectively. Now, what is the actual information that we're aiming to obtain? For vaccination, we are trying to understand the community's level of knowledge surrounding general vaccine information. For example, what is the immune system? What is a vaccine? How does a vaccine work? And how do vaccines supplement the immune system? If a community does not have basic vaccine literacy, then they may be more likely to believe in common vaccine misconceptions. Alongside that, we want to know why the community is vaccine hesitant to begin with. What factors are influencing their decision to not get vaccinated? Are these religious or cultural beliefs? Are these embedded in medical mistrust? It's important to understand the specific misconceptions and misinformation believed within the community. Do you believe that you will get the flu from the flu vaccine? Do you believe that COVID-19 vaccines impact fertility and pregnancy? Lastly, you must understand the desired methods of delivery in the community. For example, does this community utilize social media or print materials? Do they prefer cartoon or real images? What is their translation needs and what are their education levels? How can you ensure that the materials you create are useful and effective? The second step is to create. For education and outreach, you should create materials utilizing the information obtained. What are the misconceptions you heard? How do you want to address them? What platforms are best for the communities? For example, social media for Facebook might look a little different than social media for Instagram. And also note that some communities utilize alternative outreach applications like WeChat. Format is another factor to consider. Do you need PNGs or PDFs? How are you going to share out the materials? All of this information is extremely important to know before you create anything. If you have the capacity to do it, translate. Research shows that language is a common barrier, especially since vaccination can easily become a conversation that uses more scientific language. Translations, therefore, can be extremely helpful to increase access to those who are not fluent in English. Lastly, you can also plan ahead. You can cater outreach materials to different months. As many of you know, this month, August, is National Immunization Awareness Month. So we made sure to create posts dedicated to just immunization, especially as children are going back to school. The third step is to adapt. In my opinion, this is the most important step, because here we get the community's feedback on anything that we made. Are these materials actually helpful for your community? How will individuals react? Include the community's voice as much as you can, specifically influential messengers, as they can ensure that the outreach and education are relevant, helpful, and conveying the correct message. Be open and receptive to what you might hear. Again, translation. The reason why I keep emphasizing translation is because it helps to increase access, specifically linguistic access. In this step, it's important to get anything that you translate checked by an influential messenger or community partner. Simply translating is not enough. Just because you have materials in language does not mean the community can immediately access it. For example, we had education materials translated into Urdu and Hindi, but the translations were actually too formal for the community to comprehend. Here we figured the difference between traditional translation and transliteration. Transliteration is the process of transferring a word from the alphabet of one language. Some communities may speak a language fluently but cannot read it formally. That's why it's so important to get translations checked and to adapt as appropriate. It's also important to know that things might get lost in translation. Sometimes we think the community is understanding the main takeaway, but in reality, they're taking away something else. One method of ensuring that the correct message is getting across appropriately is through a process called adaptive cognitive interviews. Here, we ask the community questions to see if they are taking away the main points that we want. Here's one example. What does this mean to you? This was a survey question that we used, but we weren't sure if the community would understand the phrase societal responsibility in the context that we wanted. Through this process, the influential messengers decided that the word community would be a better in replacement in this context rather than societal. We also use adaptive cognitive interviews to ask specific wording or phrases of questions. Here, we asked the community which best resonated with them and believed that B, getting, was the best phrasing for the community. This is a great way to get the community involved in the process while also ensuring that the correct message is getting across. And the last step is to monitor. Collect data and see what works and what does not. Ask the community-based organizations to track which outreach materials they post, what platforms they posted on, the number of impressions or clicks, likes, shares, or reposts that they got. Any data helps ensure that the next materials are helpful. Likewise, collect information on the education held. Was the format virtual or in person, group or individual? Think about having pre or post education surveys to assess knowledge growth and the effectiveness of the education materials. There are many ways to do this, so get creative in how you want to assess any of the materials that you make. On top of just outreach, Asian Health Coalition creates education to address vaccine hesitancy. In order to get to the root of many vaccine-related misconceptions, it's important to cover general vaccine literacy. This means discussing in a culturally and linguistically appropriate way what is the immune system, what are vaccines, and how vaccines supplement that system. Having this foundational understanding can help mitigate the fear of common misconceptions, dealing with topics like adverse reactions, alternative medications, and more. It's also important to create education that is useful for the community. For example, while some communities have traditional classrooms type educations, others might not have as much time and would benefit from having a brochure or a packet, like some type of handout. Additionally, in today's society, it's also important to consider creating in-person and online methods for education. For our purposes, we created culturally tailored education to address vaccine hesitancy specific for Asian, African, Black, and Middle Eastern Rim communities. That is able to be utilized in many settings. These settings include English second language classrooms and workshops. While these sessions are individualized and all of the education is individualized to the community, the backbone structure of the topics covered is the same throughout. Now I will go over some strategies that we used to tailor the education to these different communities. First, we translated for the communities that had high literacy rates in another language. In this case, our Chinese community-based organizations requested that education be in simplified Chinese, since about 90% of the community is literate and prefer materials in language. Some communities have lower literacy rates, so instead of translating the entire education session for them, we chose to translate key slides in different languages and distribute them as handouts. Looking at this slide, this is an example that speaks to the importance of creating culturally adapted materials. The two pictures are the same, but the left version has a lot more words on it. This change was due to the Rohingya community feedback, as the community is mainly verbal and illiterate. This organization stated that pictures are helpful and often actually requested by their community members, but too much text can be overwhelming. Therefore, any additional text was included in a script that was read out loud and translated in time instead. While these are minor changes, they are vital as they show outreach and education as the most impactful and effective if it is adapted culturally and linguistically. Lastly, to make the education more engaging, Asian Health Coalition created videos. I'm going to show you 30 seconds of this video that discusses common flu-related myth or facts.
Myth or fact: flu vaccines will give me the flu. Myth: none of the flu vaccines will give you the flu. The vaccines are made with a killed or weakened flu virus, or only part of the virus. This means that the vaccine cannot give you the flu.
So as you just saw, the Chinese community requested and preferred English voiceovers, as they said some of their community understands English. Whereas the Rohingya community, a video would be really difficult with in-time translations, so an interactive myth or slide deck was created and used instead. Now I'm going to turn it over to Stacy, who is a community outreach specialist with the Chronic and Infectious Diseases team at Asian Health Coalition. She is our social media guru who creates all of our outreach and social media for our team. So I'm turning it over to you, Stacy.
Yeah, thank you so much, Mary Grace. So immigrants, migrants, and minorities are disproportionately represented in COVID-19 cases and deaths. Vaccine hesitancy was considered one of the World Health Organization's top 10 global health threats in 2019. Especially since the COVID-19 pandemic occurred, fewer in-person events have happened, which limited the dissemination of vaccine information to the public, such as tabling events, community events, group gatherings at community-based organizations and cultural centers, and more. As our world adapted into a virtual society, we had to as well. It is now more than ever very common to get your information from social media platforms, which is why it's so important to have accurate, appropriate, comprehensible materials. Mistrust and unwillingness to vaccinate for COVID-19 were reported, with concerns raised about the extent of misleading COVID-19 vaccination information circulating in their communities via social media, including TikTok, Facebook, and WhatsApp, and the perceived low representation of their communities in vaccine trials. With social media, there's a lot of inaccurate information, which is why we emphasize the importance of putting out correct information regarding vaccines and debunking myths with vaccine hesitancies. I'm going to discuss the best practices we've aggregated so far. Among Asian, South Asian, and Africans, the most commonly used social media platform are WhatsApp, Facebook Messenger, and WeChat. A lot of these individuals have family overseas, so they communicate through those platforms not only to talk, but to share media. Facebook, Instagram, and Twitter are also very popular. With WhatsApp and WeChat, they're not only able to communicate, but it's their mode of social media as well. They're able to share flyers and social media posts via those apps if they don't have Facebook, Instagram, or Twitter. This is why it's important to create social media toolkits tailored to each population. By giving these materials, they're able to share it with friends, families, and others on which mode of communication they use. Also, we work with various age groups, young and elderly, and some of the older generations do not have smartphones and use flip phones, which is why it's important to create both social media and physical flyers to better tailor to the target age group population. Based on what their community needs, we develop that material specified for their community. Derived from the Illinois Public Health Association policy brief titled Immigrants' Health in Illinois Medical Distrust COVID-19 Vaccines, they stated the most effective way of reducing hesitancy among these populations is to work with local organizations and community leaders to do direct outreach and education about the vaccine in an attempt to reduce medical distrust, fear, and vaccine hesitancy. This includes having tailored educational materials and personal conversations with these populations to assure them of the safety of the vaccine. Investing in immigrant outreach and education is the key to increasing vaccination rates and reducing infections in these populations. And that is exactly what we did. Through our listen, create, adapt, and monitor process, we got great feedback from our community-based organizations regarding outreach and education materials from our focus groups and surveys. The first one we noticed was the importance of statistics. Having concrete statistics is essential because it puts things in perspective and shows the reality of what's going on right now. For example, 1 in 10 Americans aged 18 and older have yet to receive at least one dose of the COVID-19 vaccine. The community also wants to hear from trusted doctors and have a trusted source to ensure the information they're getting is accurate and valid. The next one is making sure it's comprehensible. As Mary Grace discussed earlier, people do not like it if there's too much text. It deters them from reading it as they get overwhelmed with information overload. We also noted not to write it in scientific form. Not everyone knows scientific language. It's important to keep the level of education to general rather than deep diving into the exact chemistry mechanics at the micro level of how a vaccine works. We also incorporated more pictures that represent their population. It supports diversity and representation and humanizes the education and outreach material. For this, we mainly work with South Asian, Asian, and African communities. So for each community-based organization, they get different images on their materials. Another piece of feedback we got was to not include images of needles. Many people are afraid of needles, and seeing them makes them not want to get the vaccine because it looks painful. Also, including cartoon characters was not successful. We learned that having real-life images of people who represent their population is more impactful. Using real-life images of people humanizes it, excuse me. Having a more specific call to action was needed because it was too vague to just say, contact your local health department. This raised many concerns. Who is our local health department? Where can I contact them? By giving concrete resources such as putting a number to call or text and an email to contact, it gives them better resources to get the aid they need. So to ensure high accuracy of the dissemination of education and outreach material, it's very important for us to update information in a timely manner. COVID-19 guidelines are constantly being changed and updated. Once those updates are announced by the Center for Disease Control and Prevention, we go and edit the new updates and post them as soon as possible and send them out to our community-based organizations also as soon as possible. We constantly update them in a timely manner to ensure accuracy and keep people up to date on the latest COVID-19 news. Here is a before and after feedback example of flyers created and updated. As you can see here on the left, the colors are clashing and the green on top of the blue is distracting. Also, it includes an image of a needle, which the communities did not like, as well as cartoon characters. The font used on the left image was not a sans serif font. We found that using sans serif fonts are useful for making the content legible for the communities. Also, there is no call to action with no resources on the flyer for further support. And this is how we improve the before to after. On the right, in the new flyer, the colors have changed to a simpler design. We included real-life pictures as well as important statistics, got rid of cartoon characters and needles, and provided a specific call to action that says, questions, email us at hbvinfo@asianhealth.org, which is our email for hepatitis-related questions. Refugee, immigrant, and migrant populations include more than 40 million people living in the United States. Tailoring education and outreach materials per target population is essential when making outreach material. Representation is important, and having pictures that look like themselves supports cultural competency. There are many different cultures and languages spoken in the United States, so we translated our flyers and tailored them based on their language and ethnicity to have individualized outreach and education. And the flyer you see right here is the general English one. It has quick facts, the eligibility for the vaccine, a vaccination timeline, insurance information, and a specific call to action with extra resources on the bottom. As you can see here, these 3 flyers are different based on their language as well as the pictures added. The Haitian Creole one includes African American people, the Arabic one has images of South Asian people, and the Lao one has images of Asian people. We also translated this flyer into 12 other languages other than English, Haitian Creole, Arabic, and Lao. Another example is that we incorporated halal into our social media posts since we work a lot with South Asian community-based organizations. The social media post includes a passage from the Islamic Sharia guideline, and it states facts to refute vaccine hesitancy worries, such as a simple definition of what the vaccine is, and that the vaccine is halal and safe to get. This is important because it not only states that the vaccine is safe, but it is safe for their specific religion and culture, and supports linguistically and culturally appropriate materials. After getting feedback from our community-based organizations, we created social media posts with all those factors in mind. Here's an example that shows a community-based focus. It is in Chicago, as you can see on the image on the left, as well as a statistic that says, with the emergence of COVID-19 variants, we emphasize the importance of vaccination, boosters, and prevention efforts needed to protect against COVID-19 in Chicago, along with a more info section with local Chicago resources, including a website and a phone number. This next one has more good statistics on how unvaccinated people have a higher risk of being hospitalized compared to fully vaccinated people. On this page at the bottom, you can see there is another specific call to action that is different from the resource on the first page. And it states, to find COVID-19 vaccines near you, go to, which includes a government website, texting your zip code, or calling a number to obtain more COVID-19 resources. It also has real-life images of people that are diverse and inclusive. On this last image, it includes more resources again, specific local resources to go in Chicago regarding vaccine information that was different than the second, but the same as the first. So how is Asian Health Coalition addressing vaccine hesitancy? We utilize a 4-step process: listen, create, adapt, and monitor. Through listening to the community, we can create materials that address their real concerns. We lean on influential and trusted messengers to ensure everything we make is culturally relevant, linguistically appropriate, and effective. And thank you everyone for listening to us speak. We now will address questions in the Q&A box at the bottom of your screen. If you have a question and haven't asked yet, now is the time to do so.
I have a question to get us started, and this is for you, Stacy. Where do you find the real life pictures of people, and how do you ensure that they are more diverse and they include a lot of different populations?
Yeah, so Canva is the best place to go to get derived pictures because there's no copyright since they are on Canva. So what I do is I use them from Canva, and if I need to include them in a PowerPoint, I can easily snip and screenshot it and include it into the information. And to ensure that everyone is inclusive and that it's diverse, searching into the photo icon specifically helps a lot.
Again, feel free if you have any questions to put them in the chat.
I have a question for you, Mary Grace. How do you identify influential or trusted messengers?
Yeah, thanks, Stacey. That's a great question. A lot of the work that we do in order to find these influential or trusted messengers goes through just working with the community-based organizations and asking them who are people within your community that could be influential or helpful with doing vaccine-related work. A lot of these could be community health workers, or it could just be someone in the community that has a lot of impact. So basically just identifying these individuals and seeing if they are willing to be trained in how to implement these different materials. And there are 2 questions in the chat. So one of them, thank you, Isra. How do you gather media feedback from communities? So this is a really great question. I know Stacy can probably elaborate on it more, but we use a lot of analytics from where you can get information. So Facebook, for example, has good analytics and it shows you the amount of people that like it, repost it, and we can get information from there. We're also able to see any comments. And other than that, a lot of information or feedback that we get from communities is from those community-based organizations. So I will give out different reporting sheets and we can ask questions like what was useful, what wasn't useful, and how can they be more useful for you, and then we can individualize our materials going forward based off of that feedback. So thank you. There's another question. Besides social media, what outreach strategies have you utilized for getting educational materials out to the community? This is another really great question. So essentially we'll have our community-based organizations hold educational sessions and they will do their own recruitment in order to get those individuals to attend. Another great way is to have education during health fairs. So if a community-based organization is having a health fair, it's easy to just set up a table, have, like we said, either the education in the format of a brochure or some type of handout that can be given, and having a couple minutes to just go through that educational material with anybody at a health fair. So that is another really great strategy that you can use to get education out to individuals.
I can actually elaborate more on that as well. So another outreach strategy we use is sending out physical flyers to these community-based organizations, and one thing that they do is based on their target population. There's this one community-based organization that would put up flyers in their international food mart that they usually go to. So that's another great way to give out outreach material.
Great, thanks, Stacy. And then the last question that I'm seeing, what are the key components you incorporate in your trainings for influential messengers in your community? Really great question. So the influential messenger training is pretty broad. The way that I go about the training is essentially giving everyone the information on how to hold unbiased conversations, how to be culturally appropriate in your conversations and also in the materials that you create, making sure that you're open and receptive to anything that might be said. For example, we know that a lot of vaccine information and vaccine conversations can be controversial. So in order to mitigate that as much as possible, a lot of that training for influential messengers is just how do I have an open conversation and how do I make sure that conversation isn't negative in any way. You don't want to deter an individual from learning more about the vaccines or learning more about misconceptions. You want to make sure that you're having an open, honest conversation that leads to more questions and potentially could lead to someone getting vaccinated. So again, it's just having a culturally relevant conversation, open conversation that is unbiased. And then also just incorporating actual materials and how do you use those materials effectively. So for example, if we're having the influential messengers being trained on focus groups, it will be like exactly how should these focus groups be implemented? What are tips and tricks? What should you look out for? For example, we try to ensure that during focus groups, the influential messengers are not talking too much or giving their point of view too often because we want to hear the perspective of the community and not specifically from the influential messenger. And we don't want their ideas to be influencing the community's ideas or what they say. So kind of giving information on specifically how to hold these sessions, whether that be focus groups or surveys, and going through essentially like a mock trial of that. Thank you for that question.
I can answer this one that was asked anonymously. It says, when you have hosted education events, have you had any luck with webinars, or are those less successful with these communities? So most of the communities we work with don't have smartphones and use flip phones, so they're unable to log into a Zoom account. So I would say physical flyers, as well as giving the education to community-based organizations, specifically community health workers, so that they could give that education. And I think it is more successful to have it through that mode rather than webinars because it is less accessible to this community.
The one thing with webinars too that is really helpful is just to plan ahead as early as you can and to reach out to as many communities and give out the information for how to sign up for the webinar. So just really being ahead of the curve is helpful. Thank you, Maggie. There's a question. How do you increase participation? In the past, we relied on offering incentives like freebies or even coupons, but with limited funding, we can't always offer incentives. So what other strategies can you employ to increase participation of health fairs and webinars? Thank you, Maggie, for that question. I really appreciate it. The best advice that I give is leaning on those community-based organizations and leaning on those influential messengers as they can do more recruitment in person within the community. Again, increasing participation, it definitely is hard. I know it's hard with incentives as well, but the biggest advice that I could give is, again, planning early. If you can do work within the community, like going into the community and passing out flyers in person, that is always helpful, but leaning on the community-based organizations as well as those influential messengers early on to say, we have this, for example, this survey that we're disseminating, we need to get X amount of people to fill it out, and making sure that they have ample time to do so, as well as since they have stake within the community, they can go and reach as many people as they can. I don't know if you have any more advice on that, Stacy, for social media. All right, well, with that, thank you, everyone. We can, oh, sorry, Leah, go for it.
Hi, sorry, I'll hop in here. My name is Leah. I'm Program Director for the Chronic Infectious Disease Programs at Asian Health Coalition. I just wanted to chime in on some of these questions that are really great. So with the webinars, going back to the webinar question, we did have some CBL partners use interactive Zoom sessions that have worked pretty well, like just kind of, more intimate sections there. But we really don't do webinars a lot. But with this, it goes back to what Mary Grace was saying of really ask the community. There's a lot of value in, going to the community leaders or doing, kind of a brief survey within the communities that you want to reach, asking them, where do they get their information? It may be radio, it may be a newspaper, a newsletter, it may be, physical flyers at the grocery store, it may be in person. So really, I would highly suggest to take that time to ask the community, how do they prefer to get their information? And then in terms of increasing participation, one thing that we have found successful is having things almost be like a one-stop shop. So collaborate with other organizations or services, and have it be, hey, you can come here and get, we have the free flu vaccines or COVID vaccines, and we have, CRC or colorectal cancer kits that are being given out, or maybe it's, they're doing a back to school backpack drive. And so you can ask if you can, team up. So really just think creatively. And we have found a lot of success in kind of teaming up and having, it be really worth that individual's time to come and receive kind of multiple services at once, rather than, coming just for, an education session or such. So those are just a few other strategies that I wanted to add.
Awesome. Thank you so much, Aaliyah. So we appreciate everyone. Thank you so much.
Mary Grace. Okay. Sorry to interrupt, but there's actually one last question. And their question is, how do you determine compensation for influential messengers / do you compensate?
That's a great question, Aaliyah. I'm going to refer to you on that one.
Yeah, no problem. So the way that we're working with our partners is we actually subcontract to our different community-based organizations that then identify the influential messengers. So we don't directly compensate from us. However, the community-based organizations are able to, and so if they so choose. So that's the answer with that.
Are there any more questions? All right, well, we just wanted to thank everyone for attending. We will send out a link to the recording of this webinar if you'd like to rewatch or share with others. If you have any further questions regarding vaccine hesitancy programs, feel free to email Mary Grace at marygrace@asianhealth.org. Please fill out the post survey that will appear in your browser after you end the webinar. Everyone, have a good rest of your day.